Mississippi. Joining us now, Dr. Jennifer Bryan, the Mississippi Delegation Chair for the American Medical Association. Dr. Bryan, good to see you as always.
Hey, good morning. Thanks for having me back.
You bet. So give us an update from your perspective on progress or lack thereof in healthcare policy. Our legislature having been in session now for the better part of 2.5 months and about to wind it down. Postpartum Medicaid extension legislation has been enacted, signed into law by the governor. I know that was something you felt very strongly about. So what are your thoughts at this point?
I think we had a really successful session. We always have pros and cons, but nobody goes into this thinking you're going to get everything you want every time. That's just not the way this works. We've got some excellent initiatives that have gone forward. So we've seen, the progress there with tianeptine, and really the legislature came together there on getting the dangerous substance off the shelves in a meaningful way. And, you look at the fentanyl testing strips. That's going to be a huge tool with our overdose epidemic and what's going on with opioid crisis there. Of course, postpartum extension eligibility was a huge interest of ours. With the pro-life agenda, the governor has definitely put forth that that's a priority. And I really was proud of how the legislature and the governor came together there and showed that it truly is a priority. So a lot of thanks there goes out to our leaders. We've got some pitfalls in the coming weeks as you know, I think that's what we're going to talk about, was enacted, and then when that becomes reality on July 1st, and some things people need to know about.
Yeah, and the other thing that's going to be on us here in a couple of weeks, of course, is the unwinding of the Medicaid continuous enrollment provision, which has been in place since 3 years ago, March of 2020. Yeah. Kaiser Family Foundation estimates as many as 20 million Americans could be removed from the Medicaid rolls. That's a little more than 20%. If you extrapolated that and applied it in Mississippi, it's 120,000 Mississippians. How does that affect? How does that affect providers, hospitals, clinics, et cetera? What's the downstream effect of that?
We're going to keep providing the care. It's just the paperwork and the conversations there, the education piece, because so many people have difficulty when this is going to be a learning process again. I think a lot of people were used to, the eligibility coming up each year, but it's been several years now. There are a lot of people who've never gone through the process before. But Medicaid's been putting out, and Director Snyder, they've been putting out memos and really getting the information out, asking us to help educate and other partners on getting people, enrolled again or their eligibility updated.
Yeah, or perhaps...
So, yeah, it's a mess, but we work through it.
Okay. Well, transitioning to other insurance, you and I have talked before about these recent changes made in the subsidy structure of the marketplaces under the Affordable Care Act. And this seems like a place where many could land. The premium cost has been pushed down considerably after the Inflation Reduction Act made those provisions permanent that were ultimately, initially implemented in the American Rescue Plan. So this is a possible landing spot for those folks.
I think moving forward there'll be changes. People will look and see, are they eligible for a different type of coverage? I think the dates are most important at this point. I think what they're asking right now is, go ahead and update your information, because on March 31st, this process of continuous enrollment, that's kind of been a protection that was in place. I know you're aware, but just for folks listening, over the past few years where you didn't have to reapply. So we're going back to our usual processes, which is as of April 1st, that process is going to start. You can update your information now, and then after April 1st, begin that process of reapplying, to see about the eligibility requirements. And then where that factors in with postpartum is the interesting piece, because there are people who are always on Medicaid or are, on and off of Medicaid as needed, but they're used to the process. The postpartum piece between on May 11th, when the protected health crisis ends as a country, and July 1st, when our postpartum eligibility extension goes into effect, that's kind of the gray zone. Have you looked at that? I think that's the area
I
that
have.
we've been, yeah. Um, I think the intent is to cover the women. I think that's a space where if you have a baby on June 30th versus July 1st, you're looking at 2 months of postpartum coverage versus 12.
Right.
And, I think that group of people for those 40 some odd days from May 11th to July 1, that's going to be something that I know the governor and his staff and the folks at Medicaid, they're going to be looking at, because I think the intent has been, as I said, to cover the women with postpartum extension eligibility. So I'm watching that closely and hoping for some progress in that area.
Gotcha. Dr. Edney has really been sounding the horn on the financial difficulties of many of the hospitals in the state of Mississippi.
Yes.
And the legislature took a little action in coming up with an $80 million grant program, but that's honestly a drop in the bucket.
Right.
What are you hearing from the hospitals out there? What do you expect?
So we've actually just now looked at reconvening a task force we ran through COVID that connects MSMA and MHA, just to kind of really have our finger on the pulse of what they're experiencing. Certainly, a lot of our members are in leadership there, and we communicate often with the hospital association. But really, we're getting a lot of angst. But we've been hearing that for quite some time. Where's the answer? What is the answer? We can't keep doing this. Um, they talk a lot about Medicaid. We talk a lot about Medicaid, and I think those conversations are ongoing. But not just Mississippi. When you look around the country, hospitals are closing and they're downsizing services. The strain is very real. Just I was listening to you talking about the banking crisis. The fallout is very real, and I don't think there are any easy answers. And Medicaid is not the fix for everything. One suggestion that I and many others have continue to talk about is the restrictions on physician-owned hospitals, and really hopeful that there'll be some change there, because we know that the cost is lower and the quality is higher. It's in the data. That has nothing to do with what's going on with state politics. That's a federal thing. But if we can get some traction there, that's at least part of this puzzle, I think.
Yeah, makes total sense. So Medicaid expansion, of course, did not make it this year. That would extend coverage to the able-bodied adult population. Just doing a review of the cost of private coverage, it's out of sight. And I just wonder if we're going to see, with inflation hitting Americans' pocketbooks, and certainly here in Mississippi, no exception, if we're going to start seeing people just drop their coverage.
They are. And I appreciated your shout out to Dr. Edney, because for people who don't know him, he's just such a wonderful, critical thinker. And he's a good person, but he's also not rash to let's just fix it. Let's throw Medicaid at it. I mean, these are real conversations that we are all having about families are struggling, and
Yeah.
how we do this and how thoughtfully we approach this with some of the other issues we've talked about before in the past, the other plans around how we look around, and then how we rein in insurance premiums, which are, as you just said, out of sight, how we increase competition. I don't have answers for all of that, but it's all of it that's a problem. Families cannot afford the exorbitant prices of health insurance. And yes, they are going without coverage. And when Dr. Edney and team are working to get patients off the bottom, the last thing we need is to lose health insurance and drive more people to Medicaid rolls.
Yeah, or
just go without, as you said.
Right, even worse, they don't have any coverage, but they still land in the hospitals or in the clinics, and they get care because you doctors are going to still treat them,
That's
and you don't
exactly
get paid.
What I was. The charity care.
Yeah.
Yeah.
And that
it's
ultimately,
and then the hospital.
yeah, it gets transferred to those of us who maintain our coverage and pay for our medical bills ultimately.
Exactly. Eventually our premiums go up, and it just goes around and around. So hopefully we'll see more conversation.
Appreciate you joining us this morning, Dr. Jennifer Bryan. Appreciate it. We'll talk to you soon.
Thanks as always.
Coming back in the Element Wealth Studios, more to come on Midday.